All right, I'm going to go on mute.
Hi, everyone. Thank you for joining. We'll get started in just a moment. All right, everyone. Well, welcome to HHS Connect's third and final session of EBV webinar series. This is Manual Edits, Thresholds, Enforcements, and Compliant Pressure. We're joined today by In Your Corner Consulting and an EBV expert and Team Select and an EBV provider. This session takes a practical look at one of the industry's best compliance concerns, how manual edits thresholds are enforced, what happens when they're exceeded, and how providers can proactively reduce risk. We're excited today to bring you two great speakers. Before we start with that, just some welcome tips as everyone knows, please stay on mute until the question and answer. You can put questions in the chat as well. Please do not record this session. We will provide links to it to our YouTube channel that you can access after, and we'll send out any materials. We're excited to have both Christy and Megan here. Christy Piles is founder and CEO of In Your Corner Consulting. She's also a partner in the HHS Connect network. She specializes in compliance operations and program management for home health organizations and brings a unique blend of investigative and regulatory experience. She's worked as a special agent in Medicaid fraud control unit and EVV implementation for a state Medicaid agency. Christy is a delight. I've heard her speak many times. She has a wealth of knowledge and brings it forth in a way that's easy to understand and take some actionable insights from. Megan Wilson has over 2 decades of experience in healthcare. Her career journey from vice president of therapy services to vice president of technology at Team Select. She has been guided by a strong commitment to advancing innovative patient-centered care, which, trust me, we all appreciate, and are right there with Megan. She helped build a team dedicated to navigating compliance while prioritizing user experience, automation, and transparency. And she's a strong advocate for collaboration, continuous learning, and challenging the status quo through networking and thoughtful inquiry. These two ladies, again, bring a wealth of knowledge, experience, and are happy to help guide us through the discussion. So, Christy and Megan, I'll turn it over to you both.
Hey, thanks so much, Kristen, and so happy to have you here, Megan. This is a delight. Megan and I have known each other for quite some time now, and I work with our team regularly to make sure we're staying on point. And I thought this was the perfect person to come in and talk about the EBV compliance pressures because, my goodness, you have absolutely stepped up and are doing a wonderful job. So thanks for being here.
Yeah, thanks for having me. Christy, I love that in your bio is special agent because I feel like that really sums up what maybe our relationship is. Also, I just want to say, I had to actually do look a little bit back in time. We started working together 7 years ago. So we have like an anniversary coming up that I think that we
Ooh,
should celebrate. Um, One other note, and I'm not meaning to take the stage from you, Christy, here,
no,
but
no,
I
please.
just I just would start this by saying, the very first um problem that we encountered where we developed our team, Christy, you came onto our team at Team Select and we call you one of our own. Um but one of the very first issues that we ran up against is ironically, this many years, 7 years later, still our foundational problem. And so after we've configured, we support 17 states, we have over 50 branch locations, we have configured and reconfigured. And even after that, we still struggle with this, I would just say like volatility and communication when we see that, our systems aren't working together, we really have an uphill battle that you help solve us for. So thanks for the last 7 years. And I guess I look forward to the next seven since
Yes.
our EBB issues haven't gone anywhere.
Well, it's funny you say that. I think that's a good point to the topic is it's hard to get stable with EBV because something always changes. The state adds a program or they add a compliance measure or our vendors do product releases without doing testing and it makes something broke and it's really hard to just get consistent and stay compliant when there's so many different just evolving landscapes. And as we know, coming across the country, there's now more of a focus on the data that's going in for healthcare. And I think EBV is going to be a big part of that. So it's really important. Even and I love that you said that as big of a company as you are, you're still tiny and mighty at heart. I mean, you are right out there. It's not a corporate, well, we just want money. You
No,
care about the people. And that's what I absolutely love about you and your company. But even now, as large as you are and as hard as you've worked, you struggle as well. And so it's not
just like
something that,
everyone else. Yeah.
right, big or small, everybody is going to have these challenges. So, and I know that your team went from we have to be compliant with EBB to get paid. We work through several states implementing denials. And now we're at a point where they're implementing thresholds. And we're trying to get back to the
Right.
point of, okay, now we have to look at data integrity. And across the country, there's different thresholds. Some states have them, some states don't. And then some states are 100% you can't touch EBV, and others say, we don't care, just make sure you do EBV. So it's making sure that you got your finger on the pulse across the country in any state that you're in to know what's happening. And how have you done that, Meg?
Oh my gosh. I don't know that I could give you a single answer, Christy. Listen, I think I want to zoom out for just a second. If you're on the call and you're a provider, or you're not on the call and you're a provider, or not a provider. Wait, I didn't say any of that right. Anyways, no matter who you are, I think it's important to know that the mission, the OG mission behind EVV is good. It is a good mission statement. We stand behind it. When Christy, when you say like we take a mighty cause to it, we as the providers also don't want the same things that our payers and the state and the feds don't want. We don't want missed visits. We don't want people clocking in and clocking out and not being there. We want transparency. And the reason that we as a business want transparency is because we want excellent care and excellent services. That as a business approach is really important to us. So, we have this situation where the original mission statement is to add transparency to, the actual visits being performed. We buy into that, the state buys into that, the aggregator buys into that, and somehow we still have these issues. And so I think when you congratulate me and you say like, oh, like how have you come this far? I think that the mission statement still aligns us all, but the work is never done. I'll kind of get to my point here in a second, but I just felt like scaffolding to say that we believe in this is important because we're all aligned around one mission statement. We just get really caught up in the nuance.
Mhm.
So our strategy, because we believe in the mission statement, has always been to, forget thresholds, although we'll talk about that. We want to be at 100%, right? Like let's call it 80 though. Like 80 is really good because 20% of the time users just have a poor experience. They don't have internet. We know all of the story. It's a lot of things. So we have recently launched our first product where we allow the entire company to see our data and our clock in and clock out. And we have just set the standard to our, call it 80%, but make sure that every single branch, no matter if you're in Washington or Massachusetts, that you all are walking in the morning and see one set of source data. So that's really been helpful. So again, we're just attacking the mission that we originally intended to accomplish, which was get everyone to clock in and clock out, when they arrive, get that information available to the offices, and navigate when that arrival process has been interrupted. Okay. So if your company strategy is good, right? And you've done all the work, you would think that the secondary part where you just report this number would be the easy thing, right? You've already done the work. You've already called your employees. You've already built a dashboards and you've checked in on every day. And by the way, I've listened to your other series and they're quite excellent, Christy. Like
Thank you.
there's a lot, if the listeners haven't listened to these other series, there's a lot that goes into some of the episodes that have come before that of just how do you build your compliance team. But if you've done that, right, and you've done all of that work, and so now you're here and you feel like you're meeting these goals, now it's this reporting problem that we have. And so again, if anyone is on the phone and listening, start with actually achieve the goal, but now let's unite at having conversations with our aggregators in our states to say, this part is not easy. We believe that some of our states and aggregators are misaligned. We believe that they're not looking at the data all of the same way. Um, we believe that we have what any technology issue has, which is sometimes source data, data definitions. These can be different at the state level. They can be different within the aggregator. They can actually be published to us, to the providers, but be misinterpreted along the way. And so we have this immense amount of work that we are just constantly doing now with these thresholds to say we've actually met the goal. Like we've done our best to meet the goal. I think we can always do better, Christy. But we're just trying to share that information with you. And that has become the challenge.
I think that that was perfectly said. It is a challenge because, as you said, you're across multiple states, and each states have different rule. Each aggregator may think, this visit's compliant, this visit's not differently. Each state requires different data elements that you have to report that could also throw off your compliance. And it's a challenge. I mean, it's very challenging. And like you said, it's important to reach out to the states and the vendors when you feel like something's just not right. I mean, that's how we get the transparency. And I know that even if you're using an alternate vendor, like your company is, you're using an alternate vendor to report your data, your vendor may report that you're great, your compliance is wonderful, but the aggregator may not feel the same way. And the aggregator is where the state is looking. And for
Mhm,
those on the call, when I say aggregator, I'm talking about like SAN Data, HHA Exchange,
mhm.
CareBridge, TheraP, the vendor that the state has contracted with to take the data from you. So they have their own measures of compliance based on their contract with the state. So that's what Megan's been talking about is just it's so variable. It's hard to get
Wow.
a good grip on compliance when everything is so different.
It and I like the way you said that, Christy. It's a twofold problem, right? You're actually addressing compliance, and that should be very specific to your technical stack, right? Like you need to be reporting and addressing compliance. The secondary piece of that is ensuring we're all saying the same thing. And first of all, if you haven't phoned a friend, phone a friend. There there are a lot of us that have the same problem with the same issue. And then the second piece, Christy, is it's a detective work. And if you're dealing with it and you just want event session, please, like we can all hang out. But it's detective work to understand what is the state reading? Where is that source information, right? And then is that source information matching your third party technology software? For us, it's our EHR vendor. And then within that technology stack, right? Are all of those definitions and source information and data elements clear? And so what Christy is saying is you likely have three spots that you have to do detective work to understand what is the state actually looking at. Because if you're logging in and you're thinking, oh, well, like maybe the state-sponsored aggregator is telling me the one set of truth, that may not be true. Um, so so your one source of truth has space along the journey to be misinterpreted is what I'm saying.
It has, and it has been misinterpreted. And I know that we're going to get into the triggering of thresholds and audit risk. I have so much to say about that. But
Well, I'll
to
get
your
my coffee, okay?
get your coffee and get comfortable. So yeah, I think it's a valid point that what you may see in the aggregators or in your data may not really be what the state's seeing. So it's important to understand what the state is considering compliant or not so that you can align, like you said. And it sounds like there has been quite a bit of operational impact to your agency. How have you handled this operationally with getting the teams together and getting ownership and I know adoption, attrition, all the stuff that comes with EVV? How have you gotten your caregivers to clock in and out? I mean, what method do you use? Do you give them treats and cookies? Like what makes them clock in?
We do actually give treats, Christy, you're not wrong. Yeah. So let's talk about it. Let's talk about it in two pieces. One is how do you get users to we'll say use the system, right? Because I want to point out a couple of things. Users find, we know this, but it's easy to say it. Users find this experience challenging. And so, the upfront strategy is how to de-challenge that first and foremost. If you want them, they are actually showing up to our clients' houses, which is, I think, what the states and feds are worried about. But they're going to the house and they're treating our clients and they're doing a really great job of it. So the first strategy is the upfront technical approach. So how exactly do they ensure that they're going to get this EVV information across the finish line? That experience has to be as optimized as possible. Our strategy is to make sure that it's all in one system so that it's just one click. Our partners at Statewise have done a lot of work to help us with that. And so the user experience is, despite all the chaos when they walk in the door, they're just one click away. So there's your first and is the user experience. Outside of that, we know they'll still have issues, right? And so you want to know and understand where now are those issues actually occurring so that you can have conversations with the branch offices on how to mitigate and solve for those problems. And it has to be in live time, right, Christy? Like
Mhm.
when you're trying to solve for this 3 days later, it's not going to be the same conversation. So we're talking about as live as possible. Earlier in an earlier episode, you had someone say it's really stressed daily. Daily operations is, I know, something that not every agency finds it easy to keep up with, right? Because you're actually doing the work, and we know that. We know that you're trying to just get the fires, and all of the things that it takes to make sure that providers and patients have what they need. We know you're doing that, but a daily EVV approach is really the only way to go. Okay, so I said something up front. I said technical approach, the user experience, daily operations. And Christy, and this was something that really came from you, but it's now a whole team approach from the very, very top all the way through. So we meet on a regular cadence. We actually meet biweekly, in case you're wondering what the secret sauce is, with compliance, with EMR, with operations. We meet with the technical group. So we have each of those parties at the table. We meet as leaders. We also then take that same structure. So your working team, your EMR, essentially operators, your your compliance team and your RCM team need to meet at the project level at cadences. And then, of course, you have your daily approach, which is your operations team. We have been really lucky to implement recently a dashboard that just unifies our national trends. This just helps them target, you want to set their targets for, I'm going to say it because I think, Christy, you want me to, and it's kind of hard to tell. It's kind of hard to tell everyone our problems, but you got to target your like top five worst offenders, right? You have a user out there who is just forgets their phone. They forget whatever it is. They're doing a great job with client care, but they're forgetful. So you've got to target your top five, and you've got to set a goal, benchmarks for your operating team. And then, Christy, at the end, you want to give treats, right? Some positive recognition for their compliance trends as maybe an office, and also some treats for the actual user. So, we partner with with a with with a group. They're called Jolly, if you're curious, and they reward for on-time documentation. And it's point driven and coin driven, and it's just something to say, look, we know that the world is hard and that everyone is doing their best, but at the end of the day, there's something in it for everyone.
I actually love that. I have a client who will sometimes just send me treats just for just helping them. And it's so crazy. I can go to the store and I can buy the treats myself, but when you're getting acknowledged for doing something good and a treat arrives, it's like Christmas morning unexpectedly. So I think that's very valuable to know that, people do appreciate being appreciated sometimes. And that's when someone says, "Do you want a cookie?" Yeah, I actually do want a cookie.
Yeah, exactly. Yeah. Yeah, sometimes you do, EVV, sometimes you do have to come down hard. I just want to say that,
Yeah.
you have to have tough conversations, right? But if you have a team that is and you have a team that is working every day to try to get this right, and what they're facing is technical challenges, user experience, and just users and forgetfulness. And when our employees are setting their eyes on that patient-focused care, sometimes the technology isn't as important to them. So you have to re-engage with them and show them how the technology helps them help them.
Yeah, and I think that's a good point. It's something that I've been talking about more lately because we have so many different rules and policies and changes, compliance this and fraud, waste, use that, and revalidations and just everything, drinking from a fire hose that providers have to do almost daily to make sure that you're even able to stay operational. And it's important to remember, like you said, your core mission, that there are people that need services, and the reason you got into this business is to help them. And that sometimes helps quieten the noise a little bit so that you can focus on why you're really there. So I think it's good you said that, and that's something I've been trying to really push on lately because it has been hard for a lot of people with
Yeah.
EVV.
And
So I think
you're
it's important.
hard.
Well, and I think what's going to get harder, and that kind of takes us into our next learning objective is let's talk about thresholds and what happens. For those on the call, and I know this may be new for some, a manual entry or edit is something that CMS is telling states they have to monitor and report on. So this isn't something state by state. This is something that CMS nationally is pushing on to states. So each of them can set their own threshold, but what that means is if you forget to clock in or clock out or both, that's a manual entry. If you change a visit after you've done it, that's a manual edit. All of those can count against you. And if a state, I'm going to say Colorado because there's no penalties right now. They're monitoring and they're just making sure they can meet their program goals. So we'll say Colorado. They've got an 85% threshold that their program goal is working toward. So there's a dashboard, I'm sorry, there's a report in their aggregator that tells providers where they are, and they're helping providers get to that point. We've got other states who aren't taking that kind of approach, and they're saying, if you don't have your threshold where it needs to be, we're going to do a corrective action plan up to and including termination and referral to an investigative body. We've got some saying that if you have any edits that don't meet our obscure requirements that we're not going to tell you about, we're going to deny your claim or we're going to take the money back. So there's a lot of enforcement action happening with the thresholds now. So that's what it can trigger. And that's Megan, can you talk about if you do get those letters, because I know we all have,
Yeah.
what's your next step?
Yeah. So Christy, I can't stress the importance of the team approach. Okay. So I just want to say when you get the letter, it's the whole team that needs to meet. It's not a person. It's not an operator or an RCM person or a technical person. It's the team. The very, very first approach that we take is what exactly is the state looking at? And what I mean is actually what data elements are they getting? Where are they getting it? When are they receiving it? And how is it received? Because it could be that you need to do more work. It could be that your team, that you have some people just, maybe not clocking in and clocking out. And that's a fair and hard conversation. Obviously, you're addressing that with your operations team, right? It also could be, and Christy, you've done a lot of these with us, that there is a misinterpretation somewhere in the technical configuration. And so you want to align your aggregator and your state and your third-party software on the call and make sure we're all speaking the same language. So right. So you get the letter, Christy, and then you get a team, right? The team has to be pretty well oiled, to be honest, because again, it's likely a combination. It's true that it's likely a combination that your ops teams need to be on the phone with users and understand what's happening, right? Like actually, let's get the real OG goal, clock in and clock out on time, right? Um, and that's definitely going to be in the mix, but there honestly could be this, there's a lot that happens between the clock in the employee, where that lands in your software's validation process, where that lands in how the aggregator pulls it in, how they look at each individual configuration. And then is that from the aggregator what the state is looking at? You have to ask that question too. Christy, I hope I didn't like overdo this or overshare, but
No.
I can't stress the team approach because
Yeah.
you probably have more than one problem.
That's exactly right. And that leads me to, I'm really glad you reminded me of this. It's important, even though you may be working in your own system, to log into the state's solution, the aggregator, to make sure your data is making it. I have a client who, in her alternate vendor, it looks like it transmitted perfectly. And then when you log into the aggregator, it's not there. So they don't know, well, why did my claim get denied? Or why is this saying there's a threshold problem? It's because the two vendors aren't communicating somewhere. And
Somewhere.
unless you log in and look, you don't know.
Those configuration changes, it's sometimes those configuration changes aren't published, Christy. That
100%.
means that means that you can't even point a finger. No one
Right.
knew it changed. And so what you're looking at, and that's why you want Christy's saying this, but like let's just repeat it. You need to look at what exactly is your state looking at, and you have to call them and ask. You do not assume that they are getting this straight from the same dashboard you are. That might not be the case. So what exactly is the state looking at? What exactly is the aggregator showing you? What exactly is in your EMR? And also, by the way, what was the user doing?
Yes.
So you have to bring all three of that to the table, because if you leave one piece out of that, you really honestly might be missing something totally totally random, like, somewhere in the last, 6 months, just a piece of the configuration changed, then you didn't know it.
Yep, that's absolutely right. There are states that change. Well, I won't say the states, but some of the vendors update their configuration and their specifications, and they don't tell anyone. They don't tell providers, they don't tell your vendors, and then now you're seeing new rejections or you're seeing something change. So it can be complex, but this is to the Meg's point is there's got to be team, there's got to be ownership, accountability, and it's got to be daily. And I know that's tough, and I know in the beginning it's hard to get into that habit because EVB used to just be a thing. But now it's tied to other things that get you paid and let you keep
Mhm.
your money. So
Yeah.
EVB is now just as important as checking your claims.
Yeah.
So it's a thing. And
Right.
I think that kind of takes us to the audit part. And I won't go on too big of a soapbox here, but so as we're hearing more in the industry about payers and the federal government looking at data, some of the things that concern me is how the compliance is actually looked at. We know that even if your caregiver goes out, they clock in maybe 5 minutes early, clock out maybe 10 minutes late. It's life. We're human. You can't ask us to perfect the human.
Traffic,
So,
the
yeah,
world.
I've never
But
clocked in and out on time. It's always been early or late. So,
Chrissy, that shocks me.
I
Like
know that I would show up early.
I think you're there early.
I am I am always there early and I'm usually always there late or leaving late.
Yeah.
So, but yeah, it's human. So to ask us to perfect being a human, I don't think that's possible. So, but what's happening is now because if your caregiver's there, they clocked in early, they clocked out late, it's pulling from your authorization. So now you have to stop that. It may be pushing to your payroll. Now you have to stop that. And it may be pushing to the claim. How do you stop that? You adjust the visit down to what was actually there. And the minute you do that, now you're
You're
not
dinged.
compliant. Yeah,
Yeah,
it's a
you're
threshold.
dinged.
Exactly. So just being compliant with the policies and rules and all the stuff out there, it's making you not compliant. So I'm
Mhm.
really concerned as far as audit risks is the thresholds are going to put providers on the high risk category. And in some states, that's going to cause the payments to do a prepayment hold until they can verify that you
Yes.
should be paid when all the provider was doing was being compliant, doing exactly what you asked them to do. So I'm very concerned that the way we've been talking about the data may be looked at differently than it should be is going to cause good providers to make some lists that they don't deserve to be on. So saying all that, again, I said I wouldn't get on my soapbox. How do you plan for that, Megan? What documentation do you have? How do you plan for the audit that we know is going to come?
Yeah, Christy, I'm just as worried as you are. I really am. I'll tell you what our strategy is. We are trying to have these conversations now. Like we have for 7 years, by the way, but even at a very, very small provider scale, you should know who is your state representative contact, meaning contact, like who in the state is directing traffic with the payer and the aggregator. And you need your payer contact, and you need an aggregator contact, and you need your EHR contact, and then you have to have your team in place. So we don't want to wait to have these conversations when we're being told that we're not meeting thresholds. We want to have them now because Chrissy, we're doing the work.
Mhm.
We are doing the work. We believe in this transparency. We believe it's good for the feds, for the state, and for our business. We want excellent care. But to what your point is, Christy, is that they still are humans. So we want to get this, what we want to do, the strategy is to show them we are monitoring our own compliance outside of all of your systems. We have our source data intact. We are monitoring our own compliance. We have each office managing what it is that you wanted, which was 80% of this. Well, I'll call it buttoned up because everyone is different. But if everyone isn't looking at it the same, then we can't have this talk, right? If the state or the payer wants to say, you're actually just you're doing a bad job, we're trying to get ahead of that conversation early to say, and we are doing this work for you. But look at all of these places that we're just not all saying the same thing.
Mhm. That is exactly right. And I will tell you that, and this brought up a memory that I really want to share with everybody who hears this. Please listen to this. I have reached out to every payer that I have concerns with. I've reached out to CMS. I've reached out to governor's offices, and I've testified before Senate at a state level. I've just provided testimony this week in writing and feedback on a rule with my concerns about exactly what we just talked about. And last year, when I was doing my testimony with the Senate, I had a senator, a state senator, say, "Why has no one expressed these concerns to me?" It is so important, not just at the state level with your payer, but even at the legislative level. Know who your representatives are and reach out to them, because we had so many providers saying all these concerns, but no one had taken it higher than the governor's office. Take it higher. States don't want to hear from the legislative members. I worked at a state. I can tell you that everything stopped the minute we got an inquiry from a senator or a House member. So if something is wrong and you're concerned it's going to hurt your community, reach out. Don't stop at the governor. Don't stop at your payer. Go to your House and Senate and start complaining, because that's what they're there for. That's what you've elected them for. So reach out.
Christy, I don't think they know. I
They
honestly,
don't.
when we get these letters, it's real humans that we call on the other line. And and by the way, they're like nasty grams. Like, I don't know if anyone else on the call has gotten one of these, but it's like, man, you really haven't done this well. And we always have work to do, just so you know. We always have work to do. There's always somewhere where we're like, yeah, we see what you see, right? Like if a user has just kind of consistently not been diligent, yeah, we see what you see. But you have to have already been warming them up to this conversation where, yes, and we really actually, as a business, we do want to provide this for you. We stand behind it. Can we all three talk about these data elements?
Mm-hmm.
Right? Like, does it
Yeah.
actually make sense if what happened was they're 5 minutes off and your off 5 minutes is different from what your EVV is? Like, does it actually make sense that that's an edit? Do you see what I'm saying, Christy? Like,
Yeah.
well, we're not having these talks and you keep saying it, and I mean, like, I'm just like, do I leave this call and call somebody else? Like, who else has to know that these data elements don't quite make sense, right? Like, I'm not going to name, I have one state in my mind, but I just don't like want to call it out because like almost every state has a problem. But like, there's one where the actual process of authorization and billing doesn't match what they're asking for in our EVV. And then the aggregator is like, we're going to get in trouble, or like the payer and aggregator relationship, however that works. We're going to get in trouble if you don't just do what we tell you to do. Well, hold on, everyone. That's not actually meeting compliance. That's just
Mhm.
configuring the software differently. How did that meet anybody's goal? I'm confused.
I am much like you. There is one particular vendor that is in multiple states that I and many others do not feel as though they're Cures Act compliant, because they're asking you to not be Cures Act compliant.
You're
So
asking you actually just to configure it the way they want it configured to
yes,
get
and that's
to
the
a
problem.
report of 100%. And
Yes.
we have had that problem. Christy, we're big enough and to not to kind of sit at the table and say, no, we really want to show you this. And not every provider is that big to have and have mass aggregated data and also pay for the time and money that it takes to get these conversations to happen. But anyways, I just want to say, you know, you should be doing all the right things, and that's hard. But even if you're doing all of the right things, a lot of these groups aren't having the same conversation.
That's 100% accurate. And I think if they're going to look at the compliance edits and audits and things against EVV, we need to look and see why EVV is there. EVV for the Cures Act doesn't say, well, let me see your auth. It doesn't say, let me see, oh, your payer changed. Who cares what payer changed? Why is that a manual editor entry? I mean, payer
Yeah,
changes all the time. So
right.
let's keep to
And
the core data elements.
does it match? Is your process for auth match your process
Right.
for EVV?
Yeah.
Well, I ask us to be the monkey in the middle and tell you that.
Exactly. Yeah, just
Shouldn't,
because the aggregator doesn't fit into policy doesn't mean the policy has to change to fit the aggregator.
right.
Let's make these vendors actually adhere to the policies. And I will get off my soapbox with that. That is, if anyone looks me up on LinkedIn, I actually did I had it one day and I decided to post and tag CMS in it because it's crazy. Because I consider myself a provider advocate. So I get very angry, and I'm trying not to, when these states just make really bad decisions that hurt providers, good providers.
Yeah, I want to just whiteboard with them. I'm like, well, what was your goal? Can we start there? Wasn't your goal to actually just make sure that you have the data that says whether or not a provider was there?
Keep it simple.
Keep it simple because all of it is so tough, right? Like all of these small, we're supporting over 50 branches. Like, I can just tell you at any given time, some configuration somewhere with a different aggregator isn't working. Like, probably wasn't set up the same in the first place.
Right. And I do like that you had mentioned calling out when this happens. And so for the documentation portion, and Meg, I don't know if you're in the room when I said this many times, but document, document, document. Make sure if you send an email to someone at the state or to the aggregator and they respond, keep that paper trail because with Meg, even in one of the states we were in, that paper trail allowed you to get a carve out
Oh yeah.
because we had system issues. So
Yeah.
keeping that paper trail is important.
Yeah. I mean, and by the way, like Christy, every provider, every dollar is on the line for every provider. If you are in this line of business, you are in it because you believe in it and you want your patients to do well. There's no space and there's no wiggle room and every dollar matters. And when somebody tells you that you have money on the line after you've already spent so much money to configure, to make the user experience better, to now have a whole team that is looking at this daily, and then you're told that you now have money on the line. Christy, I mean, it's shocking. And so, yes, the documentation led to we configured exactly the way you asked us to. You had a misinterpretation somewhere else.
Yeah, that's so true. And I know that we have a short time for comments, but so to wrap this up, how often you said you have a dashboard that you're monitoring? How often do you monitor that dashboard? And have you found anything that you had to respond to in your data?
Oh, yeah, Christy, like the answer is yes. So, okay, I want to say this again. It's an entire top-down approach, and that's if I don't know if anyone else is on the call, but um, if you're having a problem getting like the whole team to buy in because it's EVV, I mean, maybe buy t-shirts. It's really tough to get everyone aligned and to have this conversation. But we have a leadership approach to monitoring the dashboard. And then we have target goals, right, at the middle level. And then at the downstream level, it's the daily approach. And I'm not saying we're perfect, Chrissy. I will tell you, the first chance we got a peek at the data, we were like, oh, because it was the first time we could see it nationally. And we had been logging into these aggregators for years, 7 years, to just show us like incrementally what is happening. And then we were piecemealing it all together and then trying to interpret it and then having these calls. So the first time that we actually saw our information in one centralized spot after, um, quite a bit of cleaning and validation, we were like, yeah, we do have some places to target. So thanks. I won't overshare, but I would just say this. Any office has a set of users that is probably the focus point. Most of the users are actually doing okay and forget sometimes. There are a target set of users almost in every office that we can now see. Like here's your zone. Go for the top five. Because if your top five are causing the 20% of your problems, you know, if you have, let's call it 20, 40, I don't know, I'm making up numbers at this point. But you can just target a couple, you're probably solving most of your threshold problems.
So we're going to start a hashtag that says check your data.
Every day.
Check your data
Every day.
every day. Check
Every
your
day.
data.
That's tough, Christy. It's so
It
tough. You
is.
know, we say all the words like, I'm just gonna joke with you because I think it's fair, and maybe people can ask questions and share their stories too. But like, our agency took a real technical forward approach. We like actually forgot to have conversations with ops in some of these. We did, we forgot. So we would get on the phone and we would say, look, we gave you this technical win. And they'd go, is this billing? And we were like, oh no, we messed up. We didn't include everyone in the journey. And so we've had to do a lot of back work to get everyone alongside in the journey. But it's a daily approach. It is look at this every day. And if you look at it every day, you can mitigate most of the problem.
Agreed. All right. So I think we're coming up on our Q&A time. I saw Ellie come on camera, so I think that's our cue.
Thanks, Ellie.
Thank you both. I went off camera because I could see myself up on the top screen, and there were so many times when I went off camera, I was throwing my head back laughing. You both, that was just so fantastic and so timely and accurate. So thank you both for such a wonderful conversation. Yeah, and I'm ready to move on to Q&A if you both are.
Yeah.
Sure.
Perfect. Awesome. So I did have one question originally, but it seems it seems very thoroughly answered. Especially, it was as EVV requirements continue to evolve and enforcement pressure increases. What advice would Team Select or In Your Corner Consulting give providers that may still be operating with fragmented processes or limited internal resources? What foundational steps should organizations take now to build accountability, strengthen team ownership, and prepare for the future of EVV compliance? I know a lot of that was answered with the team building and orientation more than anything. The user experience, timely live conversations as problems arise, the daily checking of EVV operations, and hashtag check your data. But if there's anything else that you want to add on to that question, because I know that was kind of on the fly, but that seems very sufficiently answered, especially with the team approach and just getting everyone involved on the project level.
Well, Ellie, I would just be mindful of saying, if you feel like this is really hard, it is. And if you feel like you're short on resources and you're actually spending money to solve for this, you know, one, phone a friend, and two, make sure you're telling your state because they don't realize how much money you're spending. Like, I want to say that in a very heartful way. You likely are spending money to solve this problem, and it's because of this fragmented approach, and that feels really unfair in a really tight gross margin industry.
Definitely. Well, thank you. And I did have one more question, but I did want to open the floor to anyone else. If you're a little camera shy, you don't have to jump on and ask. Feel free to drop it in the chat or just message me separately and I can read it out for you. I had one more question. It was, across the industry, organizations are approaching EVV implementation very differently. From both the provider and compliance expert perspectives, what operational strategies have proven most effective in creating sustainable, scalable compliance processes instead of reactive workflows? And I think that is kind of almost a tangential question onto the last one a little bit, with daily check-ins and regular basis.
Yeah. If you're operating in more than one state, you still want to have one central strategy and goal.
Okay.
So we encountered that early on. So it's almost looking at it as meet the goal as a national, if you're operating in more than one place, because you would likely have downstream, you likely have two different sets of, you could have for just by crossing state lines, you could have 4 or 5 different pieces of technology to account for. So you've got to keep your leadership and your focused goal clear. And then your downstream fire drills, Christy and I worked really hard to make sure that the team is really well oiled. So don't try, and I'm saying this out of we failed so many times before we could figure it out. If you're approaching it with an RCM leader, that's amazing, but without the whole team, they're left without the ability to solve for the problem. If you're approaching it with a really strong operational leader, you're missing your RCM counterpart. And if you're approaching it with a really strong technical leader, you're leaving yourself with the inability to actually implement change. So it just has to be the team. And I say that because it took us a long time to figure that out and get that really oiled.
Awesome. Awesome, thank you. And I know when we had talked before, with all the trials and tribulations, getting to that point of kind of being the gold star, well-oiled team, it's just so awesome. And for our listeners and people who watch us after too, to hear and hopefully have lessons learned from this too, and just know the team approach more than anything. So thank you for both of those questions.
Oh wait, team approach, and Chrissy said treats.
Yes,
And
yes,
treats.
yes. That is what,
And
especially
treats.
when you mentioned, well, I do want a cookie. Yes, positive reinforcement always. Awesome. Well, thank you, ladies, both so much. It's been a pleasure. That concludes our. If unless there's any closing comments, I don't wanna take the spotlight away from anyone.
No, I think Meg has
Okay.
done a great job. I
Yes.
can't say anything that she
No,
hasn't
Christy,
already
this
said.
was so fun. Thank you so much for having me out. I need like t-shirts. Could we just do t-shirts next time? We'll be like, you get these fun t-shirts.
We promise.
Absolutely. And it just says hashtag check your data on it.
Check your data every
Check your data.
day.
Amazing. Well, thank you both so much. I really appreciate your time. And that concludes our webinar for today. All
Thank
right.
you.
Thank you, everyone.